to look at any crystal structure, I will use that software. راح انزل لكم لينك انه which website to go او يعني to download let's say the free academic version. يعني the nice thing about those softwares طبعا هدول اللايسنس لهم مكلفة جدا. يعني احنا مشتركين لا مش مشتركين، احنا ببيوفيا. يعني you can use those softwares to do let's say الجوبs computational let's say modeling اللي احنا بنعمله. بس for viewing the crystal structures the nice thing about those companies انهم they have provided free version. بس تعطينا الاوبشنز انه how can let's say I rotate the structure, download the crystal structure. كيف انا ممكن for instance يعني to view that crystal structure. في options احسن، فبالتالي مثلا اذا بدي افرجيكم surface of that let's say crystal structure it would be much better. هلا السوفت وير اللي embedded in this database it's good بس ما بتوفر لنا كل شيء. يعني the bad thing يعني كانت بالسوفت وير اللي قبل لما حدثوها صار ما في availability انه نشوف السيرفيس around الليجند. فمثلا الهيدروفوبيك باكيت لو بدي افرجيكم اياها ما بتكون واضحه. فانيثينغ يعني لما نطلع على الكريستال ستراكشر ان شاء الله الاسبوع الجاي هيك في اشياء بتوضح لسه اكثر واكثر. واللينك راح انزلها على الاي ليرنينج على اساس انه اذا بده اي حدا ينزل هاي الفري اكاديميك فيرجن مجرد انكم بس تعملوا ساين اب يعني على يعني الويب سايت you can let's say download that version. طيب هلا احنا حكينا عن just let me go back to the slides first بس اتاكد انه الكونسبت of type 1 type 2 inhibitors واضحه بالنسبه لكم. okay recall انه last lecture we did mention that we can the kinase inhibitors that we will be discussing for this course are the ones which are classified as type 1 or type 2. okay absolute type 1 type 2. يعني بالليترشر هلا لو ترجعوا صار في more let's say I would say more thorough division انه type 1 and a half type A1 and so on. احنا بس بدنا نركز على 1 و 2. تمام. هلا الفاريشنز بين 1 و 2 in terms of the kinase conformation they bind to ايش هي؟ اللي موجودين كمان online feel free let's say to join the conversation or the discussion. type 1 inhibitors بفضلوا الactive conformation ولا inactive conformation؟ الactive. okay يعني structure wise they fit more, they form more stable complexes with the active conformation. as for type 2 inactive conformation. تمام. طيب about let's say DFG motif, that segment which is conserved almost in all kinases بتكون in or out بالactive conformation. in inactive بتكون out. okay and what is meant by in and out انه بتكون عندي الاسبارتيك acid let's say trajectory is away from the ATP binding site or towards the ATP binding site. that aspartic acid residue برضو كمان هي لما تتحرك الفينيل ألانين okay which F stands for الفينيل ألانين also moves opening an allosteric site or closing that allosteric site. okay طيب هلا structure wise أنا كيف ممكن أميز بيناتهم؟ يعني for instance الجيفيتينب which is shown in here كيف ممكن تحددوا إنه it favors البايندينج or it can bind type 1 أو الactive aspect conformation ولا inactive conformation؟ yes exactly. هلا يعني لو بدنا نطلع على كل structures of the kinase inhibitors you will see إنهم either rings or ring systems connected to each other via linkers. okay هلا أحدد إنهم type 1 ولا type 2 الأساس أحدد which one or which ring or ring system is the one that binds to the adenine binding pocket. okay look for nitrogen containing rings such as this one. That's the one that will bind to the let's say adenine binding pocket. This ring system is called quinazolene. رح نحكي عنها later on الجيفيتينب design and development. Now whatever is linked let's say to the adenine binding pocket يعني خلينا نحكي مثلا this is the structure of the kinase, that's the N loop, that's the C loop. يعني I've drawn it وكأنه أنا عم بطلع عليه from the side. Okay. هلا that region which connects the N loop to the C loop, يعني الأفضل هيك أرسمها. يعني بعتذر على رسمي السيء جدا. يعني hopefully إنه تكون الفكرة Okay, that's the N loop. That's the loop that connects the N to the C. This is what we call the hinge region. Okay. هلا بالhinge region there is what is known as the adenine binding pocket, or where ATP in all kinases binds in. هلا the adenine binding pocket usually connects or have a ring or ring system that can form hydrogen bond interactions with the hinge region. Okay. هلا على يعني تخيلوا وكأنكم for instance inside that binding pocket والhinge region is behind you. على شمال, okay, or to the left of whatever occupy the adenine binding pocket, this is where it would or it may enter the hydrophobic pocket. Okay. يعني الهيدروفوبيك pocket بتكون على شمال let's say الadenine binding pocket. Alright. هلا in the case of the inactive conformation بيكون عندي an allosteric site that would be open in the inactive conformation. Usually بالactive conformation بيكون closed by الphenyl alanine, لكن that phenyl alanine rotates away opening allosteric site في حالة inactive conformation. Alright. Okay. هلا لما نحكي hydrophobic pocket, why do we consider it hydrophobic? Why do you think that? Because the amino acids surrounding that pocket or surrounding that empty space inside the active site or inside the binding sites of the kinase, usually most of those amino acids are hydrophobic in nature. راح تلاحظوا انه بكل الامينو او اسف بكل الكاينيز inhibitors اللي راح نناقشهم سواء type 1 ولا type 2, whatever occupy the hydrophobic pocket, usually it is designed to be hydrophobic in nature. يعني لما نحكي احنا مثلا phenyl ring عليها halogens, fluorine, chlorine, this group I would classify it as being hydrophobic. Most of the interactions اللي راح تعملها مع الامينو acids في hydrophobic pocket راح تكون عندي van der Waals interactions, for instance, pi-pi stacking if it's a phenyl ring, and for sure again, those are, let's say, the main interactions that these rings or ring systems can form. Like, based on that, since I have nothing that will extend to the allosteric site, الجيفيتينib is type 1 or type 2? Type 1. It favors the active or the inactive conformation? الactive. Okay. The DFG conformation راح يكون in or out? In. تمام? Okay. Let's look now at the crystal structure of gefitinib bound to ال EGFR راح نحكي عنه later on, واللي هو الابيديرمال growth factor receptor. صح receptor, بس هو in the extracellular part there is a kinase domain. Okay. هلا شوية الكونكشن سيئة هون، أو أظن بجوز في مشكلة بالكمبيوتر itself. ف يعني bear with me، يعني I will شوي راح أطول لحد ما هيك أحط لكم إياه بالبوزيشن اللي بدي إياه. طيب خليني ألغي كل الووتر molecules. هاي الريد دوتس اللي شايفينها these are actually water molecules. Okay. حتى لو كان الكريستال structure flipped, it should be easy for you, okay, to be able to distinguish. You know, this is the N loop and this is the C loop, because the N loop here, or the most of what constitutes this part are the beta sheets, وعندي هاي C helix. وin between, yeah, that's the hinge region. يعني لو أنا I rotated it like this. This is the loop that connects the N to the C loop. اوكي طلعوا كيف احنا I've rotated it بحيث انه وكأني انا عم بطلع على الدرج binding to the binding site or the active site from the site. Okay, if you would click on the ligand it will zoom in وراح تفرجينا كل الانتراكشنز اللي هاي الليجند عم تعملها مع الامينو اسيدز اللي حواليها. Okay, I think هيك صارت اوضح واحسن. Alright, that's the quinazoline ring that is binding to the hinge region. يعني احيانا some softwares may show you انها عم تعمل hydrogen bond interaction بس حتى لو ما بينت زي مثلا هون. لا it's a good yeah لا it doesn't show any interaction بس if you for instance would use other softwares it may show you in this quinazoline is actually the nitrogen in here is forming interactions with the hinge region. اوكي طيب تتذكروا لما حكيت لكم انه على امتداد الهنج ريجن بيكون في عندي residue احنا بنسميها الgatekeeper residue. Okay, that's the gatekeeper residue. هلا السبيس behind it that's the hydrophobic pocket which is here occupied or that chlorinated ring can reach to the inside of it forming interactions with the amino acids inside. Okay. هلا the rest of the structure where you have a morpholine in here هاي رح نحكي عنها بس نحكي عن الديزاين of جيفيتينم why they added that morpholine وليش في عندي spacer بين المورفولين وبين الكوينازولين ring. تمام؟ اوكي هلا back to those slides and let's see an example of this drug in here. شو رأيكم؟ type 1 ولا type 2؟ 2 لأنه مكتوب عندكم 2. طيب يس هلا مش شرط يعني مرات بيكون بالسولفنت ريجن جزء كبير لكن انه none of the parts of the structure of the drug reaches the allosteric site. هلا كيف انا ممكن احدد it may or may not reach the allosteric site؟ بحدد وين الرينج اللي بترتبط بالادينين binding pocket. خليني ارقمهم 1 2 3 4 and 5. Which ring you think binds to the adenine binding pocket or rings? Yes, so this ring 3 لا it's actually 2. 2 is more this is the ring expected to bind to the let's say to the adenine binding pocket. All right, so this ring system in here is the one that will be forming interactions or occupying the adenine pocket. Okay, now to the what is linked to it may reach what? The hydrophobic pocket. Is this ring hydrophobic in nature? Yeah, it's a benzene ring attached عليها methyl ring. Okay, now the rest of the structure can extend and reach to the allosteric site. This is how you judge, you know, this drug is a type 2 inhibitor that can bind or favors binding to the active or the inactive conformation. The inactive, a DFG motif would be out. Okay? يعني وارد جدا أو a very typical question regarding the kinase inhibitors إنه ممكن أعطيكم مثلا a structure of a drug وتحكوا لي أو أسأل which conformation it favors, الactive or the inactive أو the DFG in or the DFG out conformation. For all of those information you have, let's say, to connect them together. Okay? Fine. Let's look at a crystal structure of this imatinib. Okay, so this is imatinib bound to APL kinase. رح نحكي عنه هلا shortly. Should I rotate or flip the structure of this kinase? شو رأيكم؟ مين اللي on the top؟ ال C ولا ال N؟ C. Okay, ال N loop is this one in here. عشان ما تتوه البوصلة عنا let me rotate it. All right, That's the N loop. That's the C. This is the hinge region. خليني أعمل زوم إن على الدرج أفضل. All right. Okay. So that's the pyrimidine rings that are, let's say, forming interactions with the hinge region. This is the methylphenyl that can reach to the hydrophobic pocket, and this is the rest of the structure, the, let's say, amide, benzene, and this ring in here, واللي هي إيش? A six-membered ring that has two nitrogens, a saturated six-membered ring that has two nitrogens. Do you remember its name, its common name? Piperazine, yes, that's the piperazine ring. All of this part of the structure or the drug can reach to the allosteric site. Okay. طبعا رح نحكي شوي عن ال specific interactions that imatinib forms inside the active site, بس later on نحكي عن its design and development لأنه there is one crucial interaction اللي cancer cells was able, let's say, to resist its action via mutating الامينو اسيد اللي بيعمل الانتراكشن معها، فرح نحكي ان شاء الله باخر المحاضره. اوكي. let me see. يعني مش دائما لما مثلا اعمل كليك عليها انها ممكن تبين، بس I'll do my best to see. And I am almost positive إنه this is the, let me see. This could be the phenylalanine. All right, that's the phenylalanine, بس الاسبارتيك acid مش مبينه أو لا. هي. This one in here. Yeah, that's the DFG motif. لاحظوا كيف عندي الاسبارتيك acid is pointing away from the ATP binding site, والphenylalanine is also away from the opening. يعني this is the part of the drug that is in the allosteric site. Okay, usually بالactive conformation بتكون عندي الphenylalanine هون مكانها. Okay, but in the inactive conformation it rotates away, opening the allosteric site for the type 2 to enter. تمام؟ طيب هلا بدنا نحكي عن specific أو some of those drugs being specific kinase inhibitors of some, let's say, mutated or known kinases to be upregulated in cancer. All right. رح نحكي عن the first kinase that is implicated in cancer اللي هو ال EGFR أو ال epidermal growth factor receptor. هلا أنا متأكدة إنكم أخذتوه أو يا أخذتوه يا رح تاخذوه بمساقات كثيرة، فإحنا this is not our focus. يعني إحنا our focus اللي هي the drug itself when it binds, let's say, to that kinase. بس مش غلط لما نحكي على سبيل المثال إنه الجيفيتينب is an EGFR kinase inhibitor, at least to know what this receptor does or what this, let's say, complex biomolecule does. هلا ال EGFR stands for the epidermal growth factor receptor. هلا that receptor, the extracellular part has or can bind to the epidermal growth factor. وبدون ما أشرح what it does, okay? This protein for sure what it does simply اللي هي it is involved in proliferation of cells. Okay. هلا in the intracellular part, this receptor is bound to a kinase. Once the EGFR binds in, allows for dimerization. This is what activates the kinases to interact with the ATP and their substrates, eventually transducing a signal to the molecular or to the nuclear level for proliferation to happen. تمام؟ هلا what they found out in many cancer types they have mutations in their kinase domain which makes those kinases overly active أو active بغض النظر AGFR ارتبط أو آسفل الإبيديرمال growth factor ارتبط أو ما ارتبط. أوكي؟ يس بالضبط أو إنه الكونستيتيوتيف activity بتكون جدا أعلى من أو يعني جدا أعلى من النورمال أو بالwild type kinases. So theoretically speaking أو خلينا نحكي نظريا inhibiting that kinase would be for sure potentially would limit the increased proliferation on those cancerous cells. تمام? Now, the first drug that was discovered of the first kinase inhibitor that was discovered to bind to the kinase domain of the EGFR or those tyrosine kinases اللي هو الجافيتينib. اوكي هلا احنا رح نحكي عن its precursor او the lead compound او خلينا نحكي the one from which they eventually developed الجافيتينib. هلا مش رح نحكي طبعا من البدايه رح نحكي فقط عن hallmarks of the design of جافيتينib او in other words الانالوجز اللي كانت خلينا نحكي very very important in the discovery of جافيتينib. رح نبلش with this compound. This compound بغض النظر يعني مش مطلوب منكم اطلاقا تعرفوا whether it's let's say common name or what that company called it at that time. This compound in here, they when they eventually developed it, they found out it has an IC50 of 5 nanomolar. What is IC50? What does it stand for? Inhibitory concentration. Okay. هلا لما نحكي 5 nanomolar, is this a good number? Yes, very potent. It was very, very potent in vitro. لكن the issue with that drug إنه when they started the preclinical studies or when they measured أو خلينا نحكي they wanted to test this drug على المايس, they found out إنه الأكتيفيتي بتقل بشكل كبير جدا. Okay? هلا studies have shown إنه this drug undergoes heavy metabolism. يعني once it enters the system, it undergoes extensive rapid metabolism فبصير له very quick elimination. بصير له almost elimination before it reaches its target. Okay? طيب تتوقعوا بناء على هيك معلوماتكم السابقة بالميتابوليزم وين ممكن يصير ميتابوليزم على هالدرج؟ O demethylation. Okay. What else? بالضبط. Yes, that CH3 in here اللي حكيتوه تماما مزبوط يعني but the routes they found out يعني مش كل expected metabolism ممكن يصير عندي على الدrugs. لكن for this one in particular, one of the pathways that leads to extensive rapid metabolism اللي هي بصير في عندي hydroxylation على هالمثل اللي مرتبطة بالبنزين واللي احنا specifically شو بنسميها؟ بنزلك. Okay? So بصير في عندي بنزلك oxidation. تمام؟ One of the hydrogens are substituted with a hydroxyl, and once this happens, all right, the enzymes involved in phase 2 ممكن بسهولة وببساطة وبسرعة تضيف glucuronic acid أو sulfate groups على هالدرug وبصير له quick elimination. Okay? وباي ذا واي الفيز 2 metabolism مجرد ما صار conjugation لجلوكيرونيك acid لسلفيت جروبس بصير له inactivation بغض النظر صار له elimination ولا لا بصير له inactivation. Okay? Now what else? البنزين رينج شو ممكن يصير عليها؟ بصير عليها hydroxylation, okay? Oxidation in particular hydroxylation, okay? تتذكروا إنه حكينا أو إن حكى لكم إنه let's say الهيدروكسيليشن على البنزين rings اذا في already substituents ممكن تاثر وين بصير الهيدروكسيليشن صح؟ هلا that substituent اوكي احنا بنعتبرها donating ولا withdrawing؟ withdrawing inductively بس هي donating via resonance so it's an electron donating group والمثل برضه كمان electron donating group with donating groups يا اما para or ortho directing alright هلا for this one طبعا مين more أو stronger electron donating المثل ولا LN alright this nitrogen is the one that will mostly control when بيصير في عندي hydroxylation على البنزين ring which is para to its position okay so that was the issue for this drug إنه بيصير في عندي simply hydroxylation على البنزيليك مثل وhydroxylation على البنزين ring on the para position طيب الدرج عندي بهالاكتيفيتي الرائعة بس مشكلته بصير له quick inactivation و elimination كيف ممكن أحل هاي المشكلة structurally masking اوكي او زي ايش مثلا اعطوني هيك more خلينا نحكي elaborate modification ممكن بس ممكن هاي اذا حطيتها تصير تعمل let's say خلينا نحكي clash مثلا لما الدرج يرتبط بالاكتيف سايت ف in that case alright it may lower the binding affinity يعني ممكن تمنع انه يصير metabolism but it may lower the binding affinity نفس الشيء يعني usually لما يكون عندي such an issue بحاول انه لما بدي اغير وين ما بصير عندي الميتابوليزم واغير ببايو ايزوستيريك او بايو ايزوستيريك replacements yes بالضبط okay so this is what they've done they've changed الميثل with the chlorine okay الكلورين ما في هيدروجنز مرتبطه عليها للانزيمز تيجي وتشيلها وتحط عليها OH وسايز وايز الكلورين طبعا هي a third row let's say element versus الكربون والCH3 which are الكربون يعني تعتبر second row صح this is one atom this is a group لكن size wise تقريبا the same almost طيب الهيدروجين يعني هنا لا تنسوا انه انا في عندي هيدروجين صح احنا بجوز ما بنرسمها بس you have to know by default انه definitely I have بالضبط yes I would substitute that hydrogen with something even size wise أقرب يعني الكلور كثير أكبر وكأنك أنت بتبدل ال H with a CH3 so you would substitute it with a fluorine okay لأنه حتى لو الفلورين موجودة أو when you substitute الهيدروجين with a fluorine السيتوكروم P450 family enzymes cannot when if يعني حتى لو ارتبطت بالدرج cannot break الباند ما بين الكربون والفلورين وتحول أو تستبدل الفلورين with an OH so this is what they've done they've substituted that hydrogen with the fluorine or in other words they blocked that position اللي ممكن يصير عليه hydroxylation and removed that CH3 which is a site for benzylic hydroxylation alright الactivity still كانت يعني هي double but still يعني 9 nanomolar this is perfect لكن صارت في عندي مشكلة ثانية بالدرج واللي هي إنه لما أنا أضيف هالوجنز اللايبوفيليسيتي بتزيد عندي alright so what they've done or what they have tried to do طبعا اللي احنا بنعرض لكم اياهم على فكرة few analogues من بجوز thousands of analogues ممكن يصنعوها thousands of analogues ممكن يفكروا فيها ويصنعوها and they test it هلا for let's say balancing ال log P أو نوصل let's say ال log P اللي satisfactory they attached a morpholine to the or they've substituted one of the let's say methyls in here with a morpholine ring okay هلا النيتروجين in here is an ionizable group صح it's a tertiary aphatic nitrogen that can be ionized at physiological pH هلا لما بدلوا الميثل with a morpholine مثلا خلوها قريبة لهون they found out إنه المورفولين لو تدخل في ال ATP binding site ما كانت تعمل interactions inside the binding site. Alright, لكن we needed to balance ال high lipophilicity أو أخلي هالكمباوند شوية أزيد من its polarity. فاللي عملوا they've tried to separate ما بين المورفولين والأكسجين with a أو through alkyl chains وكان الأوبتيمم اللي هي ال 3 carbons أو they've added that spacer بحيث إنه لما يرتبط الدرج تكون المورفولين وكأنها طالعة برا ال ATP binding site ما بتعمل أي interaction inside the active site لأنها ما بتعمل any interaction. That is why ما بدي إياها إنه يصير لها desolvation وبالتالي يصير في عندي what is known as a desolvation penalty. Definitely this term مر عليكم before. Let me say jump to it وبعدين برجع للسلايد اللي قبل. الdesolvation penalty هلا لما الدراجز ترتبط أو تقترب من الactive sites أو binding sites in their targets يعني ما بيكونوا هيك floating in the solvent without, let's say, any interaction with anything. Usually they are surrounded by the water molecules. This is a different drug, بس هي الفكرة نفسها. هلا, if the drug is to enter the active site, to form the interactions favored inside the active site, لازم هاي البونز تنكسر. فلما أحكي أنا عن مورفولين واللي بتكون عندي النيتروجين, let's say, probably might be protonated with a positive charge. Definitely it will be forming very strong hydrogen bond interactions مع, let's say, the water molecule, سواء this with a hydrogen or this one with an oxygen. Okay? فهلا إذا أنا أو if the morpholine is very close to the drug وبدها تدخل inside the active site لكن هي ما بتعمل أي interaction حتى تدخل لازم تكسر هاي البونز. هلا هاي البوند لما تنكسر إذا ما في إشي مقابلها to form أو to compensate for those strong interactions with the water molecules يعني وكأني أنا أعمل desolvation لكن for nothing. Okay, that is why such a process is a thermic أو خلينا نحكي energetically not favored. that is why they've added that spacer حتى أخلي هالدرug overall sorry polarity له good. It would have high أو good water solubility. تمام. لكن at the same time أنا ما بدي يصير desolvation of that group for nothing. لأنه if that morpholine is very close to the quinazoline ودخلت في الأكتيف سايت مش رح تعمل أي interaction. وكأني عملت desolvation وكسرت هاي favored interactions مع water molecules for nothing. طيب, here's a crystal structure of the kinase domain in EG of R. All right, this is the N loop, the C loop, that's the ATP binding site. If you zoom in, لاحظوا إنه this is the quinazoline bound, let's say, to the forming interactions مع الactive site. يعني هاي هون صارت أظن أوضح لكم. شايفين السبيس هيك اللي ورا هاي الring system in here. That space behind, that's the hydrophobic pocket. Okay. And let me show you the crystal structure again and rotate the drug حتى توضح عندكم صورة إنه how the morpholine is protruding outside. يعني if I would rotate it like this. Okay. Notice that the quinazoline, the halogenated phenyl ring are inside the active site وعندي المورفولين وكأنها outside. Okay. Yes. Yes. هي it does form interactions actually. بس بتكون with the خلينا نحكي يعني if you would click on it, it is forming interactions with the amino acids موجودين على الsurface مش amino acids inside the active site. يعني if this part يعني لو ما في spacer و this ring is inside يعني لاحظي مثلا عندي هنا for instance this is a hydrophobic amino acid راح يصير في عندي say I wouldn't say يعني somehow راح يكون في عندي repulsion when you have a polar group that is right next to an amino acid which is hydrophobic. اوكي يعني مقابل هاي الهيدروجين بونز اللي انا كسرتها مع الووتر الامينو اسيدز اللي مقابلها is hydrophobic ما راح يكون فيه any favored interaction ما بيناتهم. Alright. Any question up to this point about the design of gefitinib? The surface and the smaller one is the N. Yes. Okay. Here's a closer look at the same, let's say, image, but it's showing you, let's say, the interactions that all of the functional groups, or in particular nitrogens, are forming with the amino acids in the hinge region. طيب, الإيرلوتينب type 1 or type 2? Yes, it's very similar in structure to جيفيتينب. شو عملوا تغييرات؟ Yes, حطوا, let's say, an acetylene group, carbon triple bond in aspect, carbon triple bond, carbon that's an acetylene. It's also lipophilic in nature, okay? And this is a quinazoline that is in the adenine binding pocket, and this one in the hydrophobic pocket. Now this part in here, in particular those two, will protrude outside to the solvent region. Okay. طيب. A crystal structure of the drug. In this crystal structure, as if we are looking from the side, this is the quinazoline ring forming interactions of hydrogen bond interactions with one of the amino acids in the hinge region, and this is the acetylene phenyl ring that is inside the hydrophobic pocket. Lapatinib. This is also an inhibitor of the kinase domain of the EGFR. Type 1 or type 2? برأيكم؟ Two. Yes. This is the quinazoline ring that will be binding to the adenine pocket. Okay? Here, hydrophobic. And what is connected to it, that will be in the allosteric site or pocket. All right, so it's a type 2 that favors الactive ولا inactive conformation of the kinase. الinactive with DFG بتكون عندي out. All right, طيب, what about, let's say, this ring in here? Furan, yes. طيب, what about the rest of the structure in here? Similar to the morpholine, it will be protruding outside. Do we have any ionizable group in this compound or in this drug? Yes. Which nitrogen? في عنا nitrogens كثير. Yeah, this nitrogen. Okay. اللي موجودين online, can you? Oh, خلص أنا بعمل. So that's a secondary aliphatic amine that can be ionized at physiological pH. هاي الجروب إيش بسميها؟ Sulfone. Yes. A sulfur, 2 oxygens. وعلى فكرة الأصح إنها تنرسم هيك. All right. That's a sulfone group. Both of those groups, as you can see, are aiming to increase the. Like, what about this nitrogen in here? Is it, let's say, basic? Yep. Yes. بالضبط. It is highly withdrawn, أو اللون pair of electrons اللي على النيتروجين highly withdrawn inductively and via resonance. يعني it has, let's say, this electron withdrawing chlorine and nitrogens اللي هون راح يسحبوا برضه منها electrons inductively and also via resonance. It's resonating with this quinazoline ring وبرضه كمان مع هاي الفينل. Okay, فhighly, أو the lone, أو the electron density of this nitrogen is very, very low. All right. طيب. مجموعة اللي يس ايوه بالضبط، يعني فكر فيهم وكانهم هيك rings او جروبس مرتبطين او linked together. مجرد ما تحددوا وين الادينين او وين البارت اللي بيرتبط في الادينين binding pocket، يس انا ممكن هيك وبالذات يعني مثلا if the drug is flipped، يعني هي مش على يسار او يمين، يعني if I would flip the structure vertically horizontally بتصير هاي الجروبس يعني think about it انه where the nitrogens should be, let's say, positioned. يعني this is, for instance, I would expect إنه those are the nitrogens that will form hydrogen bond with the hinge region. بفكر إنه الhinge region هون. alright. لو if you would flip the structure بحيث إنه تصير عندي nitrogen هون, this is where the hinge region will be. This is the part that will reach the hydrophobic part. This is the part that will reach the allosteric site. Okay. يعني again إحنا يعني هلا صار في deviations كثير in terms of the classification of the kinase inhibitors زي ما حكيت لكم. فهلا لو ترجعوا ل papers وبالذات ال most recent ones راح تشوفوا إنه في further classification 1.5, 2.5, A, B and so on. إحنا يعني ما بدنا هيك to be highly confused with those. Most of the FDA approved kinase inhibitors are classified as either type 1 or type 2. فهاي اللي إحنا راح نركز عليه. يعني الأمثلة اللي راح نحكيها are those which are classical examples of type 1 و type 2. واللي راح يجيكم في الامتحان كمان برضه راح تكون classical examples عشان ما يصير يعني hopefully any confusion. طيب. Look at the crystal structure again as if you are looking at the kinase ATP binding site from the side. Here's the quinazoline ring forming interactions with the hinge region. Okay, that's the chlorophenyl in the hydrophobic pocket, and this one is reaching the allosteric site. يعني لو عملت rotation راح تشوفوا إنه this part in here is extended in an allosteric site. Okay, and this one in here is the DFG motif. لاحظوا كيف بتكون عندي let's say this يعني if you would rotate it you will see إنه الأسبارتيك أسيد وكأنها away. Okay. طيب هلا هل دائما بالallosteric site الجروبس that will reach to the allosteric site لازم إنها تكون hydrophobic in nature؟ لا. Okay. الallosteric site is diverse من one kinase to another. يعني most of the kinases okay الهيدروفوبيك pocket بتكون usually hydrophobic الامينو acids اللي فيها. So when you design type 1 ولا type 2 you need to think in whatever that will bind in the hydrophobic pocket should be hydrophobic in nature. But what can reach or extend to the allosteric site بيعتمد. Some kinases الامينو acids اللي في الاكتف في الallosteric site ممكن يكونوا hydrophobic in nature, ممكن يكونوا let's say ionizable groups وممكن يكونوا a mixture. So you may see let's say groups in those that extend to the allosteric site ممكن تكون ionizable besides let's say a hydrophobic, a very hydrophobic let's say group and so on. فالdiversity بالallosteric site هي اللي بتسمح بالdiversity of the type 2 inhibitors برضه كمان بالselectivity. Okay, it does contribute to the selectivity of kinase inhibitors or type 2 kinase inhibitors to the different kinases. طيب, vanditanib. Think. مين بيوافقها إنها type 1؟ Yes, it's type 1, all right? So again, it's very similar in structure, by the way, to gefitinib or erlotinib. Here, this is the quinazoline or the quinazoline ring that binds to the adenine pocket. The hinge region is here, okay? Well, hydrophobic in here, okay? That's the hydrophobic of the ring that will bind to the hydrophobic region, okay? Here, this part will extend to the solvent region. Do I have any ionizable group? Yes. لا, hi. Yeah, this tertiary nitrogen. What do we call this ring? البيريدين لما تكون completely unsaturated أو لما تكون let's say aromatic. لما تكون completely saturated piperidine بالضبط. That's a piperidine ring and this is an ionizable group. Okay? All right. هلا the good thing about vanditanib versus gefitinib إنه it has a dual specificity. يعني it doesn't only bind to the epidermal or to the kinase domain of the epidermal growth factor, let's say receptor, but also let's say to the VEGF receptor. Okay, which aids or which controls the angiogenesis in cancerous cells. هلا يعني بجوز احنا بالبداية حكينا إنه selectivity شيء ضروري. بس approach is now إنه if you have a drug that can bind to more than one kinase that are implicated in cancer, this is even better. وكأنك you are hitting two targets at the same time. The dual specificity هلا صارت approach خلينا نحكي يعني more efficient for treating the cancer than having a a kinase inhibitor that is selective for only one kinase. Okay, here's a crystal structure of the drug, the quinazoline binding to the hinge region. That's the halogenated ring, and this is what extends into the solvent region. That's the DFG motif. ولاحظوا كيف بتكون aspartic acid away. والفينيل ألانين بتكون almost، يعني لو أنا بدي أعمل rotation بتكون مسكرة الألوستريك سايت. طيب نحكي هلا عن those which inhibit ال APL kinase. أظن إنه يعني سألت أنا الشعب اللي قبلكم حكوا لي إنه this is something you've discussed probably بال yes. The chromosomal translocation where you would, in some of those, let's say, suffering from CML, yes, where you would have the PCR gene right next to the APL, فبالتالي بصير في عندي a transcription of APL that is constant, يعني always active, okay? The one drug that, أو خلينا نحكي the inhibitor that was discovered to bind the APL and treated, let's say, this leukemia or this type of leukemia اللي هو الإيماتينib. والإيماتينib, by the way, was the first FDA approved kinase inhibitor. When it was discovered, they called it a magic bullet because it was very, very selective for a kinase that was known, let's say, to be responsible for let's say development of CML. Okay. هلا مش راح كثير اركز على، يعني موجود عندكم بالسلايدز بس انا مش كثير اركز عليه يعني او ال development of imatinib. What matters to me اللي هي two important properties in imatinib structure اللي هي الميثيل group which we call or refer to as the conformational blocker، وبرضه كمان اللي هي البيبرازين ring why they had a spacer in between. بس الإيماتينب let's say development was، يعني زي ما حكيت لكم, it was a pathway of synthesis of thousands and thousands of analogs that eventually led to its development and introduction to the market. It started with this very, very, very simple molecule. Okay, you can never consider a drug. عملوا screening ل many compounds they had in their library and they found out that this compound have some activity بسيطة جدا. يعني خلينا نحكي مثلا بالمايكرومولر برينج 10 to 20 or even higher micromolar. Okay, to us يعني ما بنعتبره active إطلاقا، لكن still it was considered a good lead. يعني reference compound أنا ممكن أعمل عليه development that may lead to the eventually to the خلينا نحكي to a more selective, way more potent drug. And this is what they've done. One of the زي ما حكيت لكم يعني مش راح نبين كل الانالوجز اكيد اللي حضروهم وفكروا فيهم وصنعوهم، لكن راح نحكي عن الهول ماركس اللي هي التشينجز اللي انعملت that led to selectivity and that led to increased potency. When they've added a pyridine ring to the pyrimidine ring, this gave rise to an increase in the activity towards the phosphokinase C. Okay, now introduction of a phenylamide group increased the potency. تقريبا ال IC50 وصلت ل 5 micromolar. يعني كل ما قلت ال IC50 كل ما كان definitely أحسن. All right. Now, when they've introduced a methyl, this increased the activity against the tyrosine, let's say kinases, and it became selective toward the tyrosine kinases واللي من أمثلتها اللي هي ال APL. Okay. رح نحكي عن هاي الconformational blocker later on، يعني إن شاء الله في المحاضرة الجاي. Another thing أو another structural modification that they've done أو thought about اللي هي attaching a piperazine ring to this phenyl ring. لكن زي ما كلكم تعرفوا إنه those nitrogens that sorry, now you cannot connect it directly. They needed to have a spacer. يعني they cannot, for instance, have a nitrogen that is directly connected to this, أو مش not, but in some cases when you have a nitrogen that is connected directly to the a benzene ring, بالعادة ممكن هاي النيتروجين may enhance الهيدروكسيليشن اللي بيصير عندي على البنزين, which leads to the يعني as you all know, the intermediate for aromatic hydroxylation اللي هو اللي بنسميهم الارين اوكسايدز او الارين ايبوكسايدز، واللي هم very very reactive intermediates that are sometimes implicated in cancer. Okay. Also, in some cases when you have a nitrogen that is connected to a benzene, احيانا ممكن انه يصير في عندي hydroxylation to that nitrogen followed by sulfation, which leaves giving rise to a nitrinium ion that is very very reactive. Okay. So that is why when they wanted, let's say, to attach a nitrogen to this ring, they had a spacer حتى إنه يقللوا chances for any mutagenicity. تمام؟ Again, I'm not very interested إنكم تعرفوا exactly the route to the development of Jeffy imatinib. What matters mostly إنكم تعرفوا mainly إنه that development where in particular they've added the methyl or that conformational blocker is what led, let's say, to some selectivity to tyrosine kinases versus serine threonine kinases. Okay. طيب بدنا نشوف بس الانتراكشنز inside كintroduction للأسبوع القادم، بس نحكي عن resistance against the kinase inhibitors and how that resistance may result from one single mutation زي ما هو في حالة الإيماتينب. يعني الإيماتينب هلا للأسف many patients may respond at first but then the cancer may not then or may become yes resistant to it. هلا one of the reasons they found out إنه ليش some cancers may resist the effect of imatinib, single mutation بينعمل ب one of the, let's say, الامينو اسيدز اللي موجوده في الاكتيف سايت ببطل الدرج يرتبط بهالانزيم او البايندينج افينيتي بتقل بشكل كبير. That is why it becomes ineffective towards الاكتيف او خلينا نحكي ال APL kinase. Okay. طيب here's a crystal structure اللي what is highlighted in yellow is what? Yeah, so that's the APL kinase. This is the drug, imatinib. The one that is highlighted, if you zoom in, the one that is highlighted in yellow, this is the DFG. Just notice الفينيل alanine. هلا بالactive conformation بتكون exactly this is where its position will be. But in the inactive conformation لاحظوا كيف بتلف عندي opening that allosteric site for the rest or for that part of the drug to reach to the allosteric site. Okay. These are the pyridine, pyridine, pyrimidine ring that bind to the hinge region that is highlighted in green. This is the methyl phenyl that reaches the hydrophobic pocket, and these are the piperazine ring with the phenyl and amide that can reach to the allosteric site. Okay. هلا a very important interaction that this drug forms اللي هي ما بين this nitrogen and threonine, which is a gatekeeper residue. All right, at the opening of the hydrophobic pocket. زي ما راح نشوف بالمحاضرة إن شاء الله القادمة, that single mutation of threonine to another residue is the reason or one of the reasons why some cancers later resist the effect of imatinib. Okay, another important interaction اللي هي what this piperazine forms with the amino acids اللي موجودة في allosteric site. هلا بالسلايدز اللي عندكم مكتوب إنها it forms interactions with the glutamic acid. هلا زي ما راح تشوفوا بالcrystal structure this is actually not the case. يعني بحالة مثلا ال APL there is no glutamic acid close to that piperazine ring, فهي ما بتعمل interactions معها وإنما بتعمل hydrogen bond أو sorry ion dipole interaction. بس just let me show you a crystal structure وبنكمل إن شاء الله المحاضرة اللي جاي. طيب if I want the N loop up أو at the top ألف بالstructure ولا لا؟ Yes. Okay, let me remove the water molecules first. Okay. Now this is the drug. All right, so that's the pyrimidine rings that are forming interactions with the hinge region. Rotate it again. This is the methylphenyl that is in the hydrophobic pocket, and this is the amide, benzene, and piperazines that are in the allosteric site. لا ما في because you already have, let's say, in the allosteric يعني already you have خلينا نحكي يعني with the piperazine ring, the ionizable piperazine ring, it already, let's say, لا لأنه مجرد أنت ما حددتي وين بترتبط في الأدينين pocket. okay, knowing the rest of the structures أو knowing the rest of the parts بتحددي إذا كان في عندي a group ممكن توصل للallosteric site ولا لا. يعني خليني أرجع للstructure itself. هون مثلا هلا احنا already حددنا انه this is what will bind to the adenine binding pocket. وين احط الهنج region, top or below؟ شو رايكم؟ exactly yes. لو حطيتها هون او كانت الهنج region هون, هاي النيتروجينز راح تكون away from the amino acids in the hinge region, right? And once you determine which side of the molecule or which side of the adenine binding or which side of the drug that reaches the adenine binding pocket من أي جهة, then it would be easy for you, if you are for instance standing here, to locate إنه هاي الرينج هي اللي راح تكون بالهيدروفوبيك وهاي الرينج هي راح توصل للألوستريك سايت. اوكي هلا لو أنا مثلا سألتكم في الامتحان أو for instance لو حدا فكر إنه خلينا نغير ال positions of this nitrogen to here and this nitrogen مثلا and this nitrogen مثلا أخليهم هون. اوكي حتى تعمل interactions مع الادينين binding pocket يفترض الهيدروفوبيك pocket تكون هون أو that أغير ال relative position of this one to here. Okay. All right. بس the last thing that I want to show you اللي هي just zoom in again. طيب هلا حكينا احنا دائما في على امتداد الهنج region there is a residue that forms or that is on the opening of the hydrophobic pocket. هلا that specific residue في ال APL ال wild type APL مش ال mutant resistant APL اللي هي ال threonine which is this one. عشان يعني أوضح أكثر, that's the threonine. okay. لاحظوا إنها بتكون يعني exactly where that phenyl methyl is, let's say, inserting itself in. وال threonine, it's an amino acid that has what functional group؟ بالضبط. هلا لاحظوا إنه ال OH هون, if you rotate it here, the OH here is forming a very important, crucial hydrogen bond interaction with this nitrogen that is bound to the pyrimidine. It's a very crucial interaction. لو عملنا methylation على فكرة لهاي النيتروجين, يعني بدلت الهيدروجين with the nitrogen, آسفة بدلت الهيدروجين with a methyl group, the compound becomes يا إما inactive أو بتقل الأكتيفيتي بشكل كثير كبير. اوكي هلا الانزيم شو عمل؟ غير زي ما رح افرجيكم ان شاء الله الاسبوع القادم the resistant forms of those cancers for imatinib او against imatinib, they've mutated let's say ال threonine into another amino acid ما بتعمل any hydrogen bond interaction, و because of that the activity of imatinib او ال binding affinity بتقل بشكل كبير, and this is why that cancer becomes, let's say, resistant to imatinib. Okay. رح نحكي عنها إن شاء الله الأسبوع الجاي وال other forms of, let's say, resistance وإيش ال approaches اللي usually تنعمل او اللي usually خلينا نحكي medicinal chemists think about in order to overcome this resistant issue. اوكي طيب اي سؤال؟ هاي بحكي عنها الاسبوع الجاي ان شاء الله. اوكي any question؟ اوكي يعطيكم الف عافيه يا جماعه. اللي موجودين اونلاين في اي حدا عنده اي سؤال؟